Hello and good evening out there, viewers. Thank you once again for logging on to Educate TV. You're welcome to another episode of Years to Healthy Life. We are here to give you another great topic this week. We are going to discuss on the topic prostate cancer, and it's mainly for the men, but I want all the women to be here to listen, ask questions, because I have a specialist here who is going to educate us tonight. I'll give him the chance to introduce himself and then his profession, then we go on. Hello, good evening, Mr. Bachai, and thank you very much for your time.
Good evening, Auntie Christiana. Okay, so my name is Bachai, and I am a medical laboratory scientist by profession.
Sorry, we can't hear you. Can you speak a bit louder so that, yeah.
Yes, so can you hear me now?
Yeah, it's fine now.
Okay, I am Bachana Victor. Okay, I am a biomedical scientist by profession. Yes.
Okay, thank you.
And I
Thank you very much. Thank you very much for coming to the show. Tonight we are going to talk about prostate cancer. And as a specialist in prostate cancer, can you tell us what prostate cancer is?
Okay, so prostate cancer is basically a carcinoma of a prostate gland. Okay, usually it may spread from, other parts of the body, particularly the bones and the lymph nodes from the prostate gland. Okay, so that's what prostate cancer is. A prostate actually is a walnut gland in every man, which is responsible for the secretion of, the fluid. It secretes the fluid that nourishes the sperm. Okay, so every man has a prostate gland. Every man has a prostate gland. Yes. So it is a walnut. It looks like a nut. Every man needs it. As we are growing, it also perform different functions with the help of a certain hormone called androgen.
Okay.
It has an hormone called androgen, which helps in the nourishment of the sperm. Okay. So initially, what happens is, when a cancer is being formed, it's a small lump, like let me say a clump of cancer cells. Okay, a clump of cancer cells, which usually remains in the confinement of the gland, right? It remains the confinement of the prostate gland. As time goes on, it multiplies and spreads to the surrounding of the prostate.
Okay.
Do you get me? It spreads to the surrounding of the prostate. And when it does that, it creates something we call a tumor.
Okay.
That is when a tumor is created. And then eventually the tumor also grows large. When it grows larger, it then invades the nearby organs, such as the lymph nodes or the rectum, some leaving the bone or the lymphatic system as well as the bladder.
Okay. All right.
So that's basically what a prostate cancer is.
Prostate cancer. Okay. So what causes it? What are the causes of the prostate cancer?
Okay, so with the causes of prostate cancer is usually it's actually unknown. You can say it is elusive for now. Meanwhile, we have a risk factor, certain things that we can relate to that being the cause of the prostate cancer, such as when someone is being obese. Obesity can cause it in men.
Okay.
As you are aging, yes, your age too is a factor. Your age is a factor if you have a family history as well. Let's say somebody in your family has been involved in this prostate-related disease, you are also prone to having it. And when you have low levels of vitamin D, you are also prone to having it, as well as prostatitis. Prostatitis is usually the enlargement of the prostate gland.
Okay.
That's the prostate enlargement. Yes, it also causes this prostate degree, as well as elevated blood level of testosterone.
Okay.
You get when the testosterone is also high, it may
Yeah.
cause the cancer. You see, from the beginning when I was introducing the prostate cancer, I made mention of certain hormones.
Yeah.
I made
Yeah.
mention of a certain hormone which is the androgen.
Yeah.
Testosterone is one of the hormones that androgen is responsible for.
Okay. All right. Okay. So what are the symptoms, if I may ask?
Mm. So, with a prostate cancer, somebody may show something like a weak or interrupted urine flow.
Yeah.
A weak or interrupted urine flow. Sometimes you may have blood in your urine.
Yeah.
When you go there, you have your urine, you realize there is a lot of blood in it. That's a
Yeah.
sign of prostate cancer. We have something we
Okay.
call noxuria, like you will go, like you will feel like urinating several times at
Okay.
night. That's noxuria. Yes,
Okay.
and this urea, like when you try to urinate, you pass urine, you realize just a little urine comes out. A little urine comes out. It's also a symptoms of uh, prostate cancer. Sometimes a pains in the pelvis.
Okay.
Pelvis, you feel pains around your pelvis, your spine, or your ribs. So as a
Yeah.
man, when you feel something like that, is I think is also a sign that you should also wake up to.
Okay. Okay. So is there a cure or treatment for it? If so, what are they?
Okay, so with the cure and treatment, there are let's say therapies.
Yeah.
Okay, there are therapies that can be done rather than cure. Let's say
Yeah.
treatment, for instance, we can say you can go for something we call prostatectomy.
Okay.
Okay, that's the removal of the prostate gland itself. Since the prostate is what is causing the problem, they tend to
Yeah.
remove the prostate gland from you. That's what we call the prostatectomy.
Okay.
Okay. You can also go for what we call the radiotherapy.
Okay.
The radiotherapy, that's the radiation will be directed towards the whole pelvis.
Mm-hmm.
Okay. That's a therapy as well, which can also be done. Yes, that can be done as
Okay.
well. We also have something we call the hormone therapy.
Mm-hmm.
Hormone therapy, with that, as we were saying, there is a certain hormone called androgen, okay,
Yeah.
in the body that produces a certain hormones, produce the level of testosterone and all that. So with the
Yeah.
hormone therapy, something can be done to it that will reduce the quantity of the hormones that is going to be reaching the cancer cells. Okay.
Okay.
We also have something we call the luteinizing hormone blocker.
Mm-hmm.
The luteinizing hormone blocker.
Mm-hmm.
Okay. So the luteinizing hormone blocker also stop the pituitary gland. Okay. It will tell the pituitary gland to stop making hormones. Okay. It will
Okay.
send message to the yes to stop producing the hormones that can be causing that will be producing more of the testosterone, which
Yeah.
can tend to give us some of these problems.
Okay.
So we have so many types of the luteinizing hormone blockers. There are a whole lot of them. We have the leukotriene. So many. There are so many of them. Some of them are given as injection.
Oh, okay.
There are also there are also anti-androgen blockers as well.
Mm-hmm.
Yes, there are a lot of those stuff. Mm.
Okay.
And there is also chemotherapy.
Okay. Okay.
Chemotherapy can also be yes, it's something prostate cancer.
All
Okay.
right.
It's also used in prostate cancer. Yes.
Okay.
So
So
the chemo drugs can be given.
all right. Okay. So are there medication given after these therapies?
Yes, there are medications. Just like I was saying, when we look at chemotherapy, there are many drugs, the chemo drugs, so many of them.
Yeah.
Okay, there is one, let me say, docetaxel. You see, there's one of the drugs, cabazitaxel. You see, that's one of the, there are so many of them. We have the carboplatin. We
Okay.
have the carboplatin. Yes, there are so many of the chemo drugs.
Okay. Okay.
Yeah.
All right. And when you take them, I know that there are side effects to everything. What are some of the side effects in um after this treatment and then after the medication?
Okay, so some side effects too can be, it is treatments that you are giving to the prostate gland. And since we know some of the function of the prostate, it will have effects on the prostate as well. You may have something like erectile dysfunction. Okay, when you take some
Yeah.
of these drugs, it may result in erectile dysfunction and some of these urinary, problems. Yeah, but the
Okay.
major thing, yes, is the erectile dysfunction.
All right. Okay. So are there any tests to conduct to determine if one has this kind of cancer? How do you find out if you have it? Do you have to go for a
Okay,
checkup or are there tests that you have to do?
yes, there are tests that is being done to detect prostate cancer. The number
Okay.
one test you can think of is something that we call the PSA test. That's the prostate specific antigen test. Okay,
Okay.
since we keep talking about the hormones, with the
Mhm.
prostate specific antigen, it tends to check the quantity of the prostate hormones that is in you. All right.
Okay.
So when you have a small amount in your blood, it tells us that you are okay, because every man has at least a little amount of
Hello. Since sorry viewers out there, since you're having some technical issues, we will sort it out soon.
Yeah, can you hear me?
Yeah,
Okay,
I
so
can hear
so
you now.
sorry
Yes.
for this. So we were talking about the
Yeah.
PSA. Okay, so every man has a
Yeah.
little amount of PSA, and this may increase with age. Okay,
Okay.
so the prostate cancer can increase the production of the prostate of the PSA. Sorry, the prostate cancer can
Okay.
increase the production of the PSA, which is the prostate specific antigen. And so when you take the PSA test, and it shows that actually borderline, or
Can you speak up a little bit? We can't hear anything.
Okay, so I was explaining the levels of the PSA.
Okay.
Can you hear me louder now?
Yeah, yeah, I can hear you now.
Okay, so I was explaining the various levels that we should be expecting when we have a
Okay.
PSA test done. When you do a PSA test and you are below 2.5, it
Yeah.
certainly says you are okay.
Okay.
It certainly shows that you are okay. But when you start getting above 4, that's 4
Okay.
nanograms per milliliter, then there is a problem. That is when
Okay.
you should start, going for further check like biopsy, and other tests as well. We also have a
Okay.
digital rectal examination. Okay, in this state, yes, it is also being used to check for enlargement. Okay, when we
Okay.
do the digital rectal examination,
Yeah.
that's a finger will be inserted into the rectum. Okay, so when
Okay.
it's being inserted, you'll be able to know whether there is an enlargement. Okay, which we call the benign idiopathic hyperplasia. You'll be able to
Okay.
know there's something wrong with an enlargement somewhere, which is a possible cause of prostate cancer. Okay. You
Okay.
can also go for biopsy. Okay. A biopsy which is going to be checking for the various stages of cancer. It will actually check whether the tissue is actually cancerous or the biopsy. We get a further test. Yes. And we can also do an MRI or CT scan to
Okay.
check for the staging in the lymph nodes and other stuff. Yeah.
Okay. So before someone comes to conduct this test, what are
Yeah.
some of the signs that they have to see? Do they have to get a headache, or what are some of the signs that they have to see for them to go for this test?
Okay. So as I stated earlier, I made
Yeah.
mention of okay the signs that you are when you know there is a prostate issue. Number one, when you start having uh, low sexual desire,
Okay.
low sexual desire. When
Okay.
you urinate, you see blood in your urine. That's a
Okay.
is a sign. When
Oh,
you urinate too often at night,
okay. Okay.
urinate, you feel like urinating and you realize that the urine is not able to flow the way it's supposed to, is also another sign.
Okay.
Sometimes you realize that we call something incontinence. You realize you feel like urinating, you will start urinating at the point and the urine wouldn't flow the way it's supposed to. And you realize some is still left behind. Some urine
Okay.
is still left. Very well that there's urine left in you. That's also
Okay.
I also say like pains in the pelvis, the back pain, the ribs, sign of the sign that you checking, and then your weak urine flow. That's,
We didn't hear the last one. Can you come again, please?
I mean, weak or interrupted urine flow.
Okay. Okay. We call interrupt. Okay. Okay.
Urine flow, yes.
All right. All right. Okay. So what's risk? We spoke about treatment and therapies, and we know that this
Mm.
kind of chemotherapies and radiotherapy they give side effects. Maybe people
Yeah.
might lose their hair and stuff. Is it the same as the prostate cancer?
Yes, provided you are going through chemotherapy, those are some of the possible, effect of chemotherapy, and you are
Okay.
likely to experience that as well. Yes.
All right. Okay. So what are the chances that one will have problems with impotency?
Come again, please.
What are the chances that one will have problems with impotency when they have this prostate cancer? Do you think that
Yes, there
they might be impotent? Yeah.
yes, there is a very, very high uh, chance of you being impotent
Okay.
in prostate cancer. Number
Okay.
one, number one, if you start having erectile dysfunction,
Yeah.
then we are talking about impotence here. Because at
Okay.
that stage, you cannot really erect for you to start having the sexual desires that you want. So
Yeah.
that's when the impotency begins.
Yeah.
Those are some of the few, yes, that is very true. It's very high, there's a high risk of you getting that.
Okay. And you spoke about urinary problems. We know there are other diseases that is that people have urinary problems with. So with these urinary problems, what would you get during when someone urinates? What sign would you see in the urine?
Okay, so it's actually, you see, with the urinary issues, just like I said from the beginning, we spoke about the frequent urine. When somebody is also having a urinary tract infection, the person may
Yeah.
also start to urinate quite often.
Yeah.
Okay, the person also urinates quite often, just like somebody with prostate cancer. So it's just a sign that they are similar. When somebody with prostate issue will also may have these infections, urine infection. So it is now left for you to visit a nearby hospital or medical center to ascertain
Yeah.
which of the problem actually is yours. Whether yours is a
Okay.
urine, because when we talk about blood in urine, it could also be a schistosomiasis. You get it?
Okay.
Somebody may be having schistosomiasis. At the end of the day, will also be urinating blood. You can't really be sure.
Okay.
But when you go to the hospital and the certain diagnoses are being made on you, that's when you can ascertain which one actually. But when you look at a couple of symptoms that you are getting from any of them, then you can
Yeah.
really be even sure of yourself.
Okay. So how do we prevent this from happening? How do we prevent it?
So prevention, I can say, let's say exercise. Okay,
Okay.
when we exercise a lot,
Okay.
when you exercise a lot, you can, yes, you can prevent uh, this prostate cancer.
Okay.
Much exercise, yes, much exercise can be done. And also, I would also say if you have a family history, okay,
Uh-huh.
of any of these prostate diseases, then you should get closer to the hospital as early as possible in
Possible.
order
Okay.
for you to be checked. Yes, because the earlier detection usually is the key.
Okay.
Yes,
All right. All right. So you spoke about genetic. That means people can inherit it from their family members.
exactly. If
So
your parents, you
how
happen to,
possible? What is the percentage of you inheriting it? Is it from a close family or like a long distance relations as well?
oh, it could be from a long distance relation. Okay,
Okay.
provided it is in the gene, it could be maybe the second filial generation, it could be the first generation. That's what
Okay.
we can't really be sure of. Yes, but what we should
All
know
right.
is that it is genetically, inclined. And smoking too is
Yeah.
another
Smoking.
factor.
Okay.
Yes, smoking,
Okay.
exactly. Yeah, when we watch
Okay.
our diet too very well, the lifestyle, the kind of food we eat. Yeah, because I learned too much animal fats, refined sugar. There are some. It could also be causes of it.
Oh, okay. 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 And what about drinking? Like
What
drinking
about
too
what?
much as well.
Too much
Drinking alcohol.
alcohol.
Yeah.
No, I've not. I've really not researched on the alcohol bit of it. Yes,
Okay.
I've not
But the
researched that.
smoking can
The
cause that.
smoking, exactly, yeah.
Okay.
And with the,
Okay. So
with
how
the
do you?
world,
Yeah, come again.
sometimes too, it depends on the, we have something we say the ethnicity. Okay,
Okay.
yes, sometimes around the world we realize in the North Americans and the Northern Europes, you see,
Yeah.
usually they have the higher risk, and even nowadays the Africans, they
Yeah.
also have the higher risk of the, yes, of the prostate.
Okay. So how do we detect it early? Because as humans, sometimes we don't go for checkups. We just sit down and then when something happens, that's when we know. How do we take precautions like to detect it early and then get
Mm.
medical help early?
Okay, so with the detection, I will just say the uh, the earlier we visit the health or medical center, the better. Whilst we are approaching
Oh,
the age of 40, I will even say from 30 upwards, you should
yeah.
once a while get your prostate checked. At least
Okay.
if you can't do anything, you do PSA and the prostate scan and
Yeah.
check for any form of enlargement.
Oh, okay. Okay. Is it those enlargements? Is it the same as hernia?
No,
Does it
please.
also come out like hernia?
No. Hernia happens externally, but with the prostatitis, your prostate gland is within you. Lower, it is just below your bladder. The
Yeah.
prostate gland is just below the bladder. So that which should tell you it is an internal organ. So when there is an
Okay.
enlargement, it will only be enlarged inside, and it is only a scan that can
Okay.
detect, yes,
Okay.
the
I've
prostate.
heard there are four stages of this prostate cancer. What are they?
Yeah, come again.
I said I've heard there are four stages of this cancer. Can you break them down for us?
Yeah, there are stages of the cancer. Okay, but usually it speaks about the volume of the PSA. Okay,
Okay.
it talks about the volume. That's the stage of the PSA level. That's
Okay.
the stage. We have the various stages, like the stage one, which is the volume that starts from the one less than 10.
Okay.
The one that is from the less than 10, like the nanograms per milliliter. Then the one that is less than 20.
Okay.
Less than 2 is another.
All
Okay.
right.
Then yes, and the stage 3 to from 20 upwards, which is only trying to tell us the extent at which the gland,
As well.
the tumor has, yes, occurred.
Oh,
So
okay.
usually with the prostate, yes, with the stages is usually a bit pathological.
Okay. So is it very dangerous that can cause death? Because I've heard people have it and they go through so much pain. What causes that pain?
Okay, so prostate prostate cancer in general, okay, when it's not
Yeah.
taken care of well, and we know that with the cancer cells, they spread from one organ to the
To
other
another.
if we have not
Yeah.
able to take care of them very well. So if we don't, and it tends to erupt any activity of the other organs, or get into the other organs, and also
Yeah.
by that, it may also reduce the activities of the organ or even damage the organ entirely. And we know if an organ is damaged, the next thing is it could be death. So the chance of death, yeah, I don't know, it can't be ruled out if you have not. That's
Yeah.
when you don't take good care of it. That's why we keep
Yeah.
talking about the early detection and all that. Yes.
Yeah.
So if you realize it at the early stage and you want to do the removal of the prostate, then that is
Yeah.
also the way forward, which will prevent it from even spreading to the other side of it.
Okay. So at what age can one get this prostate cancer? Does it start from a younger age? Because I know mostly it's with men. So at what
Mm.
age
Yes,
can
as
this
early
start?
as 40 years. As early as 40 years
Oh,
old,
oh,
someone
okay.
can get a prostate cancer. Because with the prostate gland, it grows whilst you grow. So if you don't practice a good lifestyle, if you don't practice a
Okay.
good lifestyle, the prostate also grows. Then may even grow more than you even is supposed to be. So with
Okay.
the age factor, yeah, it could be as early as 40.
Okay. 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 So our time is almost up. To wrap it up, can you advise the viewers or the general public out there on precautions on what to do and what to do to stay away to prevent this from happening?
Okay, so what I would tell the our viewers is that prostate cancer is real, just like any other cancers. Okay,
Yeah,
all our men should take a very good care of themselves. Excessive smoking
yeah.
must be stopped. If at all you can even quit smoking, it will really help. We should maintain a good uh, eating lifestyle. The kind of food we eat, the junk food we eat, the refined sugar,
Yeah.
as we were saying, can also be a factor. We should make sure we also exercise quite often.
Okay.
Exercise can also help us, to stay away from prostate cancer. Also, we should visit the health centers as often as possible. As a
Okay.
man, the moment you get to the age of 30, try and get a prostate scan and a PSA test done for you to be
Okay.
sure of yourself. At least if you're able to do that every year, maybe your
Okay.
birthday, every year as your birthday present, from the age of 30, your birthday present,
Right.
just get yourself a PSA scan, a prostate
Okay.
scan as well as a PSA test. That's what I
Okay.
would tell our men out there.
All right. Okay. Thank you very much. Thank you very much. Viewers out there, our time is almost up. You heard what the specialist said. He said from age 40, make sure you test. You make sure you go for a yearly scan to the health center to make sure to see if you really have it or not. And then also make sure you stay away from smoking, eat healthy, and then always do as much exercise as possible. On this note, I would like to say thank you very much for tuning in and watching us. Um, Next week, we're going to bring you yet another great topic from another specialist. So thank you very much. And thank you, Mr. Bacha, for coming on to educate us on this topic. Thank you
Thank
very
you for
much for
having
your
me.
time. God bless you.
Thank you for having
Thank
me.
you. Viewers out there. See you next week. Bye.
Bye bye.